Hello everyone, I'm Dr. Saurabh Dikshit and today I'm going to tell you some key steps that you need to follow for making a great results in the exams like INICET. So you know, as INICET is around the corner and many of you must have seen or gone through a lot of videos and recommendation what to do, what not to do. I'll not waste a lot of your time but tell you that INICET is one of a very prestigious exam and the approach for INICET is totally different. It's not like the conventional exams that we have like NEET, UG, NEET PG. So NEET PG is a different, you can say, stratosphere, and INICET is totally different. So this is an exam where a lot of conceptual questions are asked. The number of questions are 200 and you need to understand that as far as subjects are concerned, we have lesser number of questions but the quality is very great, very good quality questions. And very important thing that you need to follow is that what should be your, you can say, preparation strategy to ace in INICET. I have seen lot of students who actually when they top INICET, they are not getting great results in NEET PG. The concept is totally different. INICET is the exam for the conceptualists. So those who are based on the conceptual ground, those who have very strong base concepts about the topics, they are going to. So one thing that you need to do is revise the last 5 years questions. At least go through those questions. What I am going to tell you, it's not like the questions will be repeated. Yeah, 10-15%, 20% questions are often repeated, but actually you should go through those hot selling topics. So these topics are very important and brush up through those topics. Now, when you're talking about the surgery as a subject, because I am a surgeon, so I will guide you about surgery. So when you talk about surgery, do revise general surgery at least twice or thrice. So general surgery, trauma, they are the crux. So general surgery, trauma, breast and plastic surgery. And along with that, nowadays you get questions on vascular surgery also. So these are 4 important topics that you need to concentrate on and will not take a lot of time. So burn is very important, CA breast is very important. When you talk about general surgery, fluids, cannulas, then topic of shock, topic of trauma, and in trauma nowadays urotrauma is very important because last year 2 questions were directly from renal trauma and urethral injury. So it's very important to understand the basics. And INICET is all about basic. And as far as surgery is concerned, it's very easy to get good marks in INICET only by just studying less. So if you see the topics that you have to concentrate on, they're not the voluminous topics. When you talk about GIT, it's not like that there will not be questions from GIT. Definitely there will be. But if you have 15 questions or if you have 20 questions and out of that 80% questions come from these 4 topics, first try to secure those questions and then only go for the voluminous part like GIT, urology. So this is one take. Then on the day of exam, this is what is very important, that stay cool and comfortable. So don't think like you have to crack. Yes, you will crack, that is one thing, but you need to hold your patience. So be comfortable. This is just an exam, this is not an end of life. So you may be successful or you may fail, but you should not feel demotivated that you're going to go for a tough exam, you're going to attempt those questions, what will be results, you may go through, you may not be able to make out. So try to understand this is just an exam, so take it comfortably, go with the full enthusiasm and definitely you will be able to. Now when you talk about questions, how to understand these questions. Now you don't get 10 questions of surgery, 10 questions of medicine, 10 questions of gynae and ops. So they're all staggered and puzzled up. So one question may be from anatomy, another question may be from biochem. So try to understand that, hold your nerves. It's not like that if you have got 2 tough questions and then the next question is easy and then again 2 tough questions. So you are thinking now the exam is lost. Students, if the exam is tough for you, it is equally tough for the student who is sitting next to you or who is attempting the same examination paper in other institutions. The competition is with you and your caliber students. So don't think that your competition is with us or the faculties. It is amongst you. So don't panic about the things. Now when you talk about the exams, what is the difference between the people who actually make good results and people who couldn't make out? It's not like they were not genuine in their preparation, they did not give adequate time. It's only and only how well you hold your nerves in the exam. There are a lot of people who make silly mistakes, and actually the toppers don't do silly mistakes. So the first rule that you have to follow is that don't panic in exam. When you are attempting the question, read the question twice. Now there's a technique of reading the question. Like suppose if we get a question related to SEEP, what is the SEEP grading? And this is the last word, what is the SEEP grading? So read the question from behind. So read, no, I'll not say read it completely from the behind, read the last line what they are asking first. So read the last line of the question what they are asking and then start reading the question. Do read the question twice, because there may be a problem of optical hallucination that happens during the exam. You miss out a point. So read it twice, and this is how you need to attempt a question. Remember, there may be a choice which is too close with another one. So out of 4 options, there may be 2 choices which may be, you can say, contraindicating or contradictory basically. So in that case, always choose the best possible answer in that case. So don't think, there may be a possibility that all the 4 options are wrong. So in that also, you need to attempt the best possible answer in relation to that case scenario. Remember, clinical vignette type questions are asked, image-based questions are asked. So you need to see the image first. Suppose if you get an image-based question, see the image first, then read the last line and then read the points. So it's very important that INICET, you should take it comfortably. And let me tell you, INICET is easier than NEET PG. So if you have a slight, you can say, control over your concepts, you will be definitely able to make out. So last 5 years questions are very, very important. Be comfortable, take a good sleep before exam. Don't think that on the last of exam you will be revising a lot of stuff and this and that. I'll revise the tables, and then you are going and mugging up the things. Give your brain a rest before taking that tough exam. So sleep properly. I would say don't take any stress. Everyone will be on the other side of the horizon. If I have done, you will also do. So don't worry about that part. So take a good sleep. Don't take panic. Stay away from rumors, stay away from controversy, stay away from all those people who demotivate you. Yes, if anyone should get selected, it should be you. This should be the temperament, and give your best. And that is what will be making you successful. The second thing is that whenever you are reading the question, don't panic about the answer first. Always read the last line of the question, then give 2 readings to the question, and this is how you have to do. Don't take the bluffs in the first go. So don't start marking the question in bluff in the first go. Suppose the questions for which you are 100% confident, you should mark them comfortably, go with that, and then you should mark the questions for review and then see the questions where you have doubt. Because if you start wasting your time in the questions where you have a lot of doubt, you will actually not be left with time to attempt the questions which you actually knew. So this is one very important thing, that is time management, and time management is actually related to the comfort zone of your brain. So don't panic about the things. Try to solve the questions, mark the questions. Those are very easy, which you know first. When you talk about image-based questions, look at the image, read the last line, then read the question, then read the options. Always try to choose the best possible answer. So students, this is a very small video, and I know that you all will come up with very good results, and my all best wishes are with you. And take my words, take the exam with cool and comfort of your, you can say, mind, and definitely you all will be successful. So all the best for your exams.